Hello everyone and welcome to Seattle Study Club Annual Symposium 2021. My name is Shouresh Charkhandeh and I'm a practicing dentist in Canada. I've been practicing dental sleep medicine for just about 15 years now. I'm also the head of faculty and a strategic advisor at Zephyr Sleep Technologies, the developer of Matrix Plus technology. The expert tip that I have for you today is, of course, with regards to dental sleep medicine, and to be specific, how to incorporate dental sleep medicine into your general practice in a way that is predictable, efficient, and simple, while maintaining that quality of care that sleep physicians and our medical colleagues expect from us, with the utilization of Matrix Plus, of course. Most of it comes from my own personal experience and challenges that I had in my dental sleep medicine practice prior to utilization of Matrix Plus. Not knowing whether or not a treatment is going to work, not knowing exactly at what mandibular position do I need to set my appliance, and of course the impact that I had on my conversation with the medical doctors asking me whether or not the therapy is going to work, and my answer was always like, well, I don't know. I hope it does and I'm going to do my best. It works for 70-80% of patients, but I cannot tell for sure. And of course the other challenge was being able to do it in an efficient way and not having to see the patients multiple times. Well, the tip that I have for you may not come as a surprise to a lot of you. It's in proper treatment planning. That is, gathering all the relevant information in advance, the medical diagnosis, the sleep study, their dental status, their dental treatment plans, and of course the treatment objectives from the patient's perspective and from the clinician's perspective and then from our perspective. Putting all that data together and put together a proper treatment plan that is going to guide our oral appliance therapy. Of course, two really important pieces of information that we need is whether or not the therapy is going to actually work for the patient, whether or not mandibular repositioning is going to get rid of their sleep apnea, and also at what level of mandibular protrusion. These are the two pieces of information that the Matrix Plus test is going to provide for you. So how do we do it in our practice? When the patient's coming to our practice, the first thing that we do is we put together a diagnostic records for our patients, which includes their x-rays, their photographs, and of course the Matrix Plus study, the theranostic study. Then we bring the patients back and we go over what their objectives are, what are they expecting for their oral appliance therapy, and we go over the data. Well, we can tell you the appliance is going to work for you and it requires this much protrusion. So in a sense, we're bringing the final outcome right to the starting point, making it a lot easier for the patients to feel confident in therapy. And of course, we don't have to see the patients multiple times. That of course changed our relationship with the physicians as well. Now when we discuss it with the physicians, they all know the patients that go through our program, they go through our therapy, they will for sure be treated, and we're eliminating that chance of treatment failure. The biggest surprise that it had in our practice was, of course, the number of patients that we're now seeing. Before, 80 or 90% of our patients would end up on CPAP therapy. Now, because of the Matrix Plus testing, we can identify that 60 or 70% that are going to respond to oral appliance therapy and put them through that efficient therapy and not having to see them multiple times. So hopefully this is going to help you in your dental sleep journey and simplify your practice. When Zephyr developed Matrix Plus technology, the idea was not to create another technology or another tool, but it was to make oral appliance therapy and dental sleep medicine safer for the patients, easier for a lot of dentists to incorporate it into their practice, and of course meet the expectations and requirements of the sleep physicians as well in terms of maintaining that quality of care. Thank you all and enjoy the rest of the meeting.